Okay, this is part 2 of the book review of The Garbage Collector about dentistry by Dr. Gammal or Gammal's Dentistry. These are just some miscellaneous quotes by him. He says, for health to be regained, the toxin factory, like amalgams and root canals, it must be removed. So that's a big statement because other dentists would not really sort of buy that. But believe me, he's coming from a smarter, better informed place than they are. He says the teaching of dentistry is still based on dogma and vested interests. It's for the money. It's not scientific. It's not health enhancing. The patient is a sacrificial lamb. That's been my experience too, is that in general, the medical system could care less about the patients. Big money from above, the billionaire perverts control the drug companies, control the insurance billing places, and they want their money. They want to take all the money they can away from the stupid proles. And if the prole gets sick, who cares? It's just a stupid prole. That's how it works. Okay, that's why only Christianity could fix it. Unchallengeable dogmas are usually not true. Like a dentist is not allowed to say that amalgam is bad, or they'll take their license away. They'll fire them. Same thing for bad mouthing root canals, saying they're all infected. That could get a dentist in big trouble. So they keep them afraid. And he says the dental societies are like fire-breathing dragons that terrify the regular dentist to ever criticize all the BS in the field. He said modern dentistry, as it is usually taught in practice, is one of the single greatest causes of systemic disease. And no pill can fix dental diseases. That's another thing I learned too. Again, I came up in conventional medicine where the attitude is nobody knows the cause of anything. You just give them drugs, and if the drugs don't work, you try a surgery. Okay, that's conventional medicine. And then I learned all about these nutritionists, and Walter Kempner, Nathan Pritikin, Burkett, McDougall, Swank, and all these guys. And they're like, gee, they can cure tons of patients. They can cure the majority of the patients if they get to them fast enough. So I'm like, wow, nutritional medicine is the most powerful thing. But there's still patients who you do the nutrition perfect and the patient doesn't get better. And so what you should think about, your first thing you should think about when you hear that is toxins. Toxins due to dentistry problems, root canals and amalgams, other toxins like fluoride, aluminum, or, there's other toxins to think about too, non-organic food, estrogenic chemicals. So you got to be aware of toxins because that opens up a whole lot of other opportunities, volatile, organic chemicals, air pollution, a whole bunch of other ways, EMF, a whole bunch of other things that can contribute to illness. And you want to know about them so you can have a higher cure rate. Back in the 1900s, he talked about Semmelweis, how he got ostracized, and that happens to all the dentists that go against convention. He says by the time you finish his book about how dead teeth should be removed and how they affect health, you'll know more than 99% of dentists. That's scary. Most dentists don't know the field, just like an internist doesn't know what causes the diseases they treat every day. The typical dentist doesn't know about the toxicity of fluoride, amalgam, or root canals. Sad. Dentists tend to be kind of crazy. He jokingly calls them Mad Hatters, like in Alice in Wonderland. They are Mad Hatters, used to work with, curing the House of Mercury. And the dentists are kind of crazy. Like I watch the dental conferences and I see their lectures online. The best spot to watch their lectures is the IAOMT, International Academy of Oral and Medical Toxicology. And you'll see their lectures. They're kind of funny because a lot of their personalities are kind of impulsive, a little bit angry, a little bit anxious. And, they also tend to have crappy video, crappy sound. And the impulsivity of their behavior and their speech is just funny. I mean, I'm used to seeing medical conferences. You watch a radiology conference. There'll be beautiful images. They know how to show a good picture of the disease and highlight the finding. A lot of the speakers are boring, but they show good pictures. If you go to a surgery conference, surgeons tend to be real serious and real logical, and they have excellent discussions of the surgical pros and cons of a given operation for a given patient. But their images are the crappiest. They'll have this giant image with only a tiny little part with the actual pathology in it. And the intelligent thing to do would be to magnify it, but they have no aesthetic sense. So that's the classic thing about surgery textbooks and surgery conferences. If you go to an oncology conference, it'll be like kabuki theater. Everybody's sort of like elegant, highly articulate, and verbally skilled. We don't want to deny the patient a chance at therapy. And then the surgeon who's really scared because the patient's old and debilitated is like, well, okay, you can try chemo instead of surgery. I'm not that eager to operate here. He doesn't want to operate because the patient's so sick and debilitated. He's not sure the patient will survive the operation. But they got very polite manners and formal way of speaking, so that's kind of fun. If you go to an internal medicine conference, they'll sit there and they'll have this giant chart of data. This is a typical internal medicine conference, and they're going to debate, 10 different studies on the pros and cons of one antihypertensive medication versus another. And all the research, in my opinion, with antihypertensive and internal medicine drugs is usually bogus, funded by the drug company. So the whole thing's a bunch of, mental masturbation, and it's so boring, it's painful. I can't take an internal medicine conference. Going to an internal medicine conference, it's like being back in grade school where some lady, remember the Peanuts cartoons, Charlie Brown, the lady's voice is wah, 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 wah. That's what an internal medicine conference feels like. It's just painful. Okay, anyways, back to this. He says medical students, MDs, don't ever learn anything about teeth. They'll only say something stupid like they were taught that fluoridation of water was the greatest public health measure ever. Yeah, right. It's a fucking poisoning people with the water, and they also poison them with aluminum in the water. Dr. George Menig, founder of the American Association of Endodontics, realized root canals were bad, and he said so, and they labeled him a moron idiot and ostracized him. Dentists are strongly trained to save the tooth at any cost. Never let the tooth go. So they'll try to keep a root canal even though it's a dead tooth. They also try to replace every tooth. Sometimes it's best to just pull the tooth and don't even replace it with anything. Dentists are mad hatters. They have the highest rate of suicide of any professional group. Mercury poisoning is a serious thing. George Orwell said, in a time of universal deceit, telling the truth is a revolutionary act. Yeah. Okay, we talked earlier about the outward flow of dental fluid through the dentine tubules going from the pulse space outward, and how a healthy body, healthy blood flow improves that. So that's another reason why you'd want, low-fat, low-sodium vegan diets with no sweets and no refined flour. Leaky guts like leaky gums, periodontal disease, bacterial toxins, they're prothrombotic. Prothrombotic, increases your risk of heart attack and stroke, okay? They're also mitochondria inhibitors, okay, especially the amalgams, but also the anaerobic toxins and root canals, the thioesters and stuff. So the relevance is they can make you tired. In addition, anything that's hurting the mitochondria is potentially going to increase your risk of cancer, chronic fatigue syndrome and cancer, so that's bad. Okay, now here's the big pioneer. This is Weston Price, and the guy was a genius. He did a lot of great things. He traveled all over the world, and all these tribes, they had good teeth if they're eating the ancestral diets. Wherever he went to Africa, he went to the Pacific Islanders, he went to places in Europe, and that's what he found, and that was pretty interesting. The other thing he did, though, was real sad. He did a root canal on his 16-year-old son, and his son died. And that's when he became freaked out about root canals, and he started doing all kinds of research on them. And he did real serious research on them, and he found out that root canals are a disaster. They make people sick because you've got a dead tooth, which is like gangrene of a toe, sitting in your mouth around all this bacteria and around amalgam chemicals. And then the bacteria in a hypoxic environment change from being aerobic to anaerobic, and the anaerobic toxins are even worse. So when you think of aerobic toxins, think LPS and LTA. Anaerobic toxins, think thioethers and mercaptans, and man, are they toxic. And they also can have a prothrombotic effect. Okay, we briefly talked about Weston Price a little bit in another lecture, and a couple other lectures I've talked about him. He wrote that neurodegeneration book I just showed you. He did this research on root canals. Dr. Gammal himself had worked in Nepal and Tibet with refugees, ancestral diets. He saw they had healthy teeth. The people who had no fluoride in the water had much better teeth than the acidified people drinking fluoridated water. Weston Price did research like if a patient had kidney disease and they removed the root canal tooth and the patient got better, he would take that tooth and implant it into a rabbit. And then he found rabbit after rabbit with the same implanted tooth would get sick and get kidney disease and die pretty soon afterwards. And for different diseases, he got the same result, that the bacteria seemed to preferentially destroy a given organ system. And he would do these to implant the same tooth in 100 different rabbits because he wanted strong proof that that was correct. Other microbiologists like Dr. Edward Rosenau, head of experimental bacteriology at Mayo Foundation, confirmed the work of Weston Price. Weston Price really was a genius. He did amazing things. And so they saw this happen over and over. They would repeat these experiments time and time again, up to 100 times, and they would get the same results. So it was real. The word for changing from aerobic to anaerobic of a bacteria is called pleomorphic change. And then they could just hide out in the dentine tubules because those things don't have any flow going through them, and the root canal tooth, dead tooth. Again, if you want to see all this information, you go to Dr. Gammal. You can go to Dr. Gammal's website, realdentalinfo.com. It's good. This is an excellent book. It really is an excellent book. If you only read one book about dentistry, I think it's the best one. I like Hal Huggins' book, Solving the MS Mystery, just because he kind of did the pioneering work himself, whereas Gammal is more like the student of Huggins and these other pioneers, and he really studied it pretty thoroughly, and he's an old guy. He has time to figure everything out. Okay. And then all these guys, they tried to discredit him because they didn't want this information to get to other people. Oh, this is just a little bit about Hal Huggins. We talked about him before. He did really pioneering research with the removal of amalgams and root canals for the treatment of MS and a whole bunch of other diseases, and was amazed at how good his results were. You can see lectures by Hal Huggins and by other pioneers at IAOMT. That's their YouTube channel. It's also a channel on other video sites, and they also have a website, IAOMT.org. Like if you yourself are considering having your amalgams removed, you can go to their website and find a dentist trained in that to use this safer techniques. Okay, titanium implants, I'm not going to talk about that right now, so that'll be the end of part 2 of dental discussion of Dr. Gammal's knowledge about dentistry. Well, there'll be a part 3 coming up a little later.